Welcome to this lecture on 1.3 Introduction to the Treatment of Ophthalmology in TCM. Today we will focus on section 1.3.1 Internal Therapies. Internal therapies form the core of systemic treatment in traditional Chinese medicine for eye disorders. The treatment approach is divided into three pillars: eliminating pathogens, regulating flow, and restoring balance. First, let's examine 1.3.1.1. The method of dispersing pathogenic wind heat. This approach uses diaphoretic drugs that are pungent and cool. It is applicable to ocular diseases due to exopathic wind heat, with symptoms like sudden onset, itching, and eyelid edema. Additional signs include hyperemia of the bulba conjunctiva, star-like nebula of the cornea, fever, and a floating rapid pulse. Next is 1.3.1.2. The method of purging fire to remove toxin, which treats oculopathy caused by noxious heat. This method uses drugs cold and cool in property to reduce fire. It applies to sudden severe cases with pain and photophobia. Symptoms include hot tears, mucopurulent secretions, swollen eyelids, and general signs like dry mouth and constipation. This method may easily damage the yang qi of the spleen and stomach. Avoid long-term use and use cautiously for corneal diseases. Section 1.3.1.3 covers the method of nourishing yin to reduce fire, targeting fire hyperactivity due to yin deficiency. It targets dryness of the eyeball, slight hyperemia, and general signs like tidal fever with red cheeks and dizziness. Differentiation is key. Red canthae relate to the heart, while dry nose and throat relate to the lung meridians deficient fire. Because these drugs are tonic and greasy, they are contraindicated for patients with dampness or spleen deficiency. The fourth method is 1.3.1.4, eliminating dampness, applicable to internal or external accumulation of dampness. Symptoms include moist ulcers, swollen eyelids, yellow turbid bulbar conjunctiva, and heavy feelings in the head. Long-term use of damp-relieving drugs can consume body fluids. Use with extreme caution in cases of yin and blood asthenia. Section 1.3.1.5. Hemostasis is used to treat hemorrhagic oculopathy by prescribing drugs to arrest bleeding immediately. This applies to hemorrhage of the pupil, retina, or macula. It is an urgent treatment for the early acute stage. Once bleeding stops, the method must shift to activating blood circulation to absorb stasis and prevent recurrence. Next is 1.3.1.6, promoting blood circulation to remove blood stasis, targeting obstruction and sluggishness. This method treats eye injuries, livid hard swelling, and obstruction of retinal vessels. Qi's activity is crucial here. It should not be used for long periods. Pregnant women and those with asthenia of qi and blood should avoid this method. 1.3.1.7 is the method of dispersing stagnated liver qi, which regulates qi to improve eyesight and alleviate depression. It applies to symptoms like distension of the eye, irritability, and chest oppression. Use cautiously with yin asthenia. In section 1.3.1.8, we use the method of nourishing qi and blood to treat cases of deficiency with tonic prescriptions. This is for chronic diseases with sleepy eyes and dim vision. The spleen and stomach are the transformation sources here. If qi is deficient, focus on tonifying qi. If blood is more deficient, focus on nourishing blood to treat dizziness. Section 1.3.1.9. Invigorating liver and kidney is for deficiency of liver-kidney yin, targeting chronic fundus diseases. General symptoms include lassitude in loin and legs and amnesia. It should be applied cautiously with pathogenic dampness. The 10th method is 1.3.110, dissipating mass, which resolves phlegm and dissipates objects like chalazion. It applies to nodular projections caused by phlegm-damp combination and stagnancy of qi and blood. Finally, 1.3.111. Relieving nebula is a unique ophthalmic method to treat corneal nebula and improve visual acuity. Treatment follows stages, dispelling wind first, then turning to relieving nebula as the pathogenic factor is removed. Timing is critical. If the nebula becomes an old one or cataract, it is impossible to cure with drugs alone. To summarize the risks, cold drugs damage the spleen, while blood-activating drugs consume healthy qi. Use this flowchart to differentiate between acute excess and chronic deficient conditions for proper clinical selection. This concludes our introduction to internal therapies in TCM ophthalmology. Understanding these 11 methods is essential for clinical practice. Thank you.